In terms of my work in the growth and development space, it started off by a simple clinical scenario that I was struggling with. Kids come to me as a child psychiatrist really late after complexities have set in, a lot of additional problems have come, and I would go, why didn't we pick them up much earlier in the piece? And there is a beautiful New South Wales health program in the personal health record, or Blue Book it's called, where there is a place for kids to get the developmental checks. And so I'm always very puzzled as to why did we miss that. So we did the FAST project following up 2,000 babies born in Liverpool and Bankstown Hospital. And we followed them up to see, go to page 8 at 6 months, has something happened? Nothing. Why didn't something happen? So it was a kind of inquiry to see what were the issues in the uptake and engagement with that policy. In particular with the multicultural families, it's a bit of an awareness and what's the need for the developmental checks. And they would say, oh, I go to my GP when my kid is sick. Why would I go to a nurse to check whether everything is okay? So that was one issue. And secondly, it was about our state and the federal systems not talking to each other. And kids and families were mostly going to the GPs, and because they are culturally, linguistically aligned sometimes, so and they find it easier because the time, hours of work aligns as well, because families would say, I can't go there between 9 and 4, I don't have transport, etc. So we said there is a big issue in terms of where the families are going and engaging with services and what our policy is requiring them to do. So we needed to bridge this gap, and that's where our FAST project was, to see whether we can go to where the children go and engage these families. Firstly, we needed to get the GPs and the primary care network and all of them on board, because state alone can't do this. And we also needed New South Wales Health at a bigger level, because it's again one patch of the state alone won't cut it. And we also went national because we wanted to test it out how things were happening in different states. So we went to Queensland with Queensland Health and the Brisbane Primary Health Network, and to Western Australia, to Melbourne, through different projects. Funding has been a bit of mix of NHMRC partnership grant, MRFF grant, New South Wales Health grant, ARC linkage grant. This is about 10 years now, from the FAST project to currently what we are doing. Yeah. The biggest impact, I would say, has been at a local level. We could see that we could double the engagement with the developmental check program. At a state level, we are very close to getting the program as an embedded one within the Blue Book, especially when we are having the electronic Blue Book coming up soon. We hope that this will be part of what they would get naturally, so that they get the reminders built into that Watch Me Grow program. And nationally, it was recognized by the Australian Health Research Alliance in their 2022 report as one of 10 projects of national impact, particularly in reaching culturally, linguistically diverse families, because we've got translations as well, and Aboriginal families particularly, and also lower socioeconomic status families who are the hardest to reach. We've been able to kind of really get on board a whole heap of clinician researchers, and from the FAST Watch Me Grow project, someone who, as a senior staff specialist clinician, did the PhD on the Watch Me Grow, is currently a clinical professor. So within the last 10 years, there has been a lot of people who have had DECRA fellowships, NHMRC fellowships, and ARC ones as well. Yeah.